Live on WFLA Now. This is Run for Fun with running enthusiast Leigh Spann.
Yeah, let's go. Welcome back to the WFLA Now Stream Center for this week's episode of Run for Fun with Leigh Spann, the show designed to showcase how running can be fun, something you can look forward to for years to come. Now, I'm your host, Leigh Spann. I'm the meteorologist here at WFLA in Tampa, but I've also been running for about 12 years now, and I still find it fun. If you were with us last week, we had a live question and answer session on Facebook Live with Coach Maria and Dr. Brian Fullem about lower leg issues. All the things runners face, like knee problems, plantar fasciitis. We talked about shoes and things. And we had so many questions that we decided to continue it this week. So thanks for, staying with us. I guess we're taping this right after, but thanks for staying a little bit longer. We had an awesome chat. So here we are. Thanks, guys.
Happy to be here.
Great to be here. You broke the fourth wall, though, on us.
Yeah. Yeah. So we're shooting this right afterwards because we don't want to take any more of Dr. Fullem's precious time. So let's get straight to some of the questions that we didn't get to when we were doing it live on Facebook. So Laura actually asked this on Instagram, and she said, when I first start running, my ankle feels like it needs to crack. It typically goes away, but should I continue to run through it or try to stop and crack it? I didn't quite know what that. Sometimes, when people come to you and ask you, Dr. Fullem, like, do you have to get more questions, ask more questions to get answers?
Probably, so for that, it's probably either air escaping from inside the ankle joint is one crack that you feel, and then the other crack that you'll hear sometimes is just the tendon snapping over the bone. So it's interesting. My wife's ankles crack like that, so she can stop and crack it, and then it releases the air of the joint, and I think it makes it feel better. So, yeah, I think if it's not painful, it's nothing to worry about. But if it makes her feel better, certainly stop. And if you can make it pop right away, then go ahead and do it.
So whatever feels good?
Yes.
Is that the answer?
Yes.
Well, Sam has that, actually. My son has, but it's not in his ankle. It's right behind his knee.
Okay.
But it literally pops.
Snaps, yeah.
But it doesn't hurt him. And I'm like, well, I guess it's okay, right?
Nothing to worry about.
Okay, that's good to know, because I would think if my knee was cracking, I would be concerned.
Yeah, he says it's uncomfortable feeling because he hears it,
right?
But not because there's
there's no pain. Yeah, if it's not painful, then I wouldn't worry about it.
All right,
it's not broke, don't fix it.
Let's go on. So we kind of mentioned this one, but Cheryl Zambrowski said that she had some slight knee pain, and so a physical therapist looked at her knee, and she said it's not a knee issue; it's a ligament in her ankle. So the physical therapist massaged her calf. Gave her some stretching exercises, and now it's better. And she wanted to know, what is this?
Yeah, there's a lot of two joint muscles. So there's a lot of muscles and tendons that'll cross your knee joint and cross your ankle joint. So sometimes it's the body of the muscle that causes the tendon or the ligament to be aggravated. So if you treat the body of the muscle up in the calf, that will sometimes make the ankle feel better.
And I know I've talked about this on the podcast before, but there was a time when, if this is my knee, that I was having problems like kind of just below it. And I just went to a normal massage therapist. I wasn't doing it because of that. I just thought that's just what it was going to feel like for the rest of my life. And so she got to my right shoulder. This is happening on my left knee. Got to my right shoulder and said, well, your ball and socket seem to be really tight here. Yeah. And I said, well, then later on she got down to my knee, and she was like, well, because it's opposite, it may be either a cause or effect. Now, your shoulder might be tight because your knee hurts, or your knee might be tight because of your shoulder. If you swing your arm a little bit more, see if that helps. And like after months, it just like went away. She said
crazy.
It's just an area in your leg that a lot of ligaments come together. And if one is irritated, it's going to hurt.
And that goes to that fascial sling. So, you go up the leg, and when you get to the pelvis, you cross over and go to the opposite shoulder. So left knee, right shoulder are going to be interacting with each other due to your fascial planes.
Also, excellent massage therapist.
100%.
And that's something really, I think.
Can we have her on the show?
Yeah, every
Lisa Jameson, I will.
Yes, okay, good.
I think every single adult runner should get sports massage done. I think it's extremely important for your fascia. If you have trigger points, those trigger points will cause some of the injuries that you have and some of the pain that you have. And that's a great preventative thing. I think even once a month if you can afford it.
And
Absolutely.
what would be some of the reasons that it would help? Because I mean, because it feels great.
Sure.
Or sometimes it doesn't even
No,
feel great.
sometimes it doesn't feel very
Sometimes
good.
it hurts, but if you have a trigger point, which is just basically a knot in your muscle, that will really affect how the muscle functions, and that sometimes can lead to injuries. So the trigger point will kind of bind up the muscle. The muscle's not functioning properly. You get stresses in different places because the muscle's not functioning properly, and the fascia is extremely important too. So sometimes physical therapists will do a technique called myofascial release. Your fascia is not the plantar fascia. The plantar fascia is really a ligament. Our fascia is like the infrastructure of our body. If you cut through the skin anywhere in the body, you'll see this white glistening layer, and that's our fascia. And fascia has blood vessels that help supply the blood supply to the muscles. It interacts with the skin, and it's really an important live tissue that we have.
And if you can't afford massage therapy on a regular basis, you can foam roll, and we can do a whole podcast on foam rolling.
And if you have gone any amount of time between foam rolls, I usually have to warn my neighbors because I think that they're going to think that I'm getting murdered or murdering
very
someone
painful.
because it's very painful. And then you do it a couple of times, and then all of a sudden it's not painful at all. But boy, if you've gone a couple of weeks without foam rolling and you do it correctly, it is pure pain.
It's a great tool though, and it's very underutilized.
I made a promise to Maria that I would do it, and I have done it. I've done it more than I used to, but still less.
Some is better than none, Leigh. I'm
Yes.
proud of you.
Thank you. All right. So
Progress, not perfection.
Right. So let's check in with Jennifer. Or she left a comment that says that she has plantar fasciitis, which is what we were just talking about. It's different than the fascia in your body. She recently did have shock therapy with her last session on March 20th. And she's still having pain during running and sometimes afterwards. So is that normal? Because Dr. Fullem, last episode you were talking, so shock therapy is very helpful, but if she's still having some pain, is that normal?
I always tell my patients, as long as you've had plantar fasciitis, it might take that long to get rid of it. And the other thing to understand about shockwave therapy, cortisone works much quicker. You get a cortisone shot, you're going to feel better in a couple of days. Shockwave takes a fair amount of time for it to work. In fact, in the studies, the maximum effect of shockwave therapy is 12 to 20 weeks after the treatments are over. So for 3 or 4 months, your body will continue to improve. And I think, what's important to consider for Patricia is if she is feeling improvement, that's a really good sign. Typically, if I'm doing the shockwave and people are feeling improvement, I know it's going to work, but progress is never linear. Progress can be up and it can be down. So even if you're feeling better, it doesn't mean that you're cured or you're better. But I think that's a good sign. And as long as she's not having pain during running, I think it's okay to run. I think taping the foot is a good idea if she doesn't have an arch support in there. Do the wall stretch, do your foot core strengthening. Those things will help. And if you have some pain afterwards, ice is always a good idea. Even if you're getting shockwave therapy, you can still ice. It won't affect it. I think one of the reasons why people will say don't use ice if you get shockwave therapy is because in the studies, I participated in an FDA study to help get one of the machines that I use approved. And in our study, you couldn't do anything else that might affect your outcome. So you couldn't even take a Motrin. You get kicked out of the study if you took a Motrin.
Oh, wow.
We gave people a bottle of Tylenol, and every time they came in for their 8 visits for over a year period, we had to count how many Tylenol they had in the bottle. That was the only rescue medicine they were allowed to take. The other component of those studies is usually you can't ice. So sometimes those things get translated over into how you treat people, but that's different than when you're doing a study. I think ice is always fine to do.
People get sick and tired of me saying ice. I'm
Yeah.
like, just ice it.
It's the best.
Please,
It's the best
really
anti-inflammatory.
Is the best.
It really is.
I was just about to say, and it's because a lot of these issues are because of things are inflamed, and when you bring something cold to it, it shrinks it.
And you have to do it regularly. You can't just ice it one time and be like, I'm done. I did it, coach. And for plantar fasciitis, I always tell them to put like a bottle of water in the freezer and then roll your foot on it. It's just the easiest way to do it.
Yep, that's perfect.
Okay, actually, we're still getting a couple of comments. One, Jim Anderson says, "What's a good way to start running with arthritis in the hips and knees?" So if you do already have arthritis, and that how would you start running?
I mean, I think walking is a good way to transition into it, but I think helping to strengthen those muscles that are around the areas where the arthritis is, so the hips, the glutes, and work on stretching and work on your range of motion. So yoga, Pilates are two good exercises if you need to be in an organized environment, and you can even do videos and do it on your own. And then doing some TheraBand exercises to help strengthen your gluteal muscles, and try to strengthen your quadriceps muscles, probably with some squats, single leg squats, things like that, in combination with slowly introducing walking, and then you can even do a walk-run program. Jeff Galloway's walk-run program is a great thing.
I actually have a question. Can we just touch on shin splints for a minute?
Sure.
Because that's probably the most common new runner injury that I see.
Yeah.
Is shin splints. I always tell them it's typically form, but there are some things that can help. So can you kind of touch on that for a minute?
Sure. So shin splints is not a medical term. It kind of encompasses a lot of different things. So when people have shin pain, if it's the quote unquote traditional shin splint, it's the medical term is medial tibial stress syndrome. So tibia is that inside shin bone. And where the pain's coming from is the two muscles that are in the calf that attach to the shin are pulling away from the bone. And that's typically what shin splints are going to be. And it's really a multifactorial treatment. There's no one thing that's going to make it go away. But for new runners, the very first thing I look at is shoes.
Yeah.
So are they running in newer shoes? And everyone has a different definition. If you're not coming from a running background, I'll say, oh, how new are your shoes? Well, I've had them a year and a half.
Yeah.
But I didn't run at all. But if you're just walking around in shoes, that cushion in the middle of the shoe is going to break down. So that's always number one, is let's get you in a better shoe. Number two is let's see what your glutes are doing.
Yeah.
Is your glute medius, your glute minimus, are they firing properly? We have
usually.
tests to check. Usually not. And then proper running form. So one of the biggest cues that I give my patients if they're running and they have shin pain, try to take shorter strides.
Shorter steps.
If you overstride a little bit, or you're a heel striker, that's going to cause more shin pain. So think about when you're running, you want to get that foot just over the opposite ankle and down, so that your center of gravity is over your foot and not behind it. And especially if you're a heel striker and you're overstriding, that's really going to help contribute to it.
Yeah.
But even in the medical literature, there's not a lot of proof in the studies of things that work. But the two things that have been proven to work is gait retraining to train your stride, and shockwave therapy are the two things for medial tibial
don't just quit
stress
running.
syndrome. Exactly.
Because mostly that's when they quit running and, I just can't run. And then they start again and they have the same exact problem because they didn't correct the stride.
Yeah.
They say, I always get shin splints.
Yeah.
And because someone just was telling me about that. Well, I'm just someone who always gets them. And it's good when I go back to them now, I'm going to say, shorten your stride. First of all, get your better, make sure your shoes are okay, but shorten your stride. I never thought about that because people think, I want to run fast, and they have these long strides.
Right.
And not only does that not make you fast, but it also can end up hurting you.
Sure, you want to take more strides, not longer strides, to run faster.
I also have a runner that actually believes, and I don't know if this is true or not, maybe you know about this, but that when her vitamin D is low, she gets shin splints. Is that?
It's certainly possible. Vitamin D is such an important vitamin. It's even called a corticosteroid because it has so many effects on the body. It's possible that there could be a relationship between that.
I wondered if you'd seen any studies about that.
I haven't.
All right, so we're still getting some comments. Jules says, Brian, what are 3 key things you can share that every runner should know? It doesn't have to be about knee issues or ankle issues. It could be, what should runners know, whether we've been running for 50 years or we've been running for 5 days?
Sure. I think one important aspect is nutrition and having enough calories.
Oh, gosh.
Really, that's a big thing is people, sometimes they get into running because they want to lose weight, but you cannot be at a calorie deficit and run and feel good because you have to have enough energy.
Thank you for
saying
that, Brian.
Relative energy deficiency syndrome.
Probably what I say the most.
It's so important. And even, I coach in high school and I see the teenagers, they don't eat breakfast. They barely eat lunch. They don't eat enough calories.
And Maria, because we've talked about this on the podcast before, Dr. Fullem, that people did get into to lose weight.
Sure.
But if you aren't eating, then your body isn't working correctly.
It starves itself, and you stop burning calories as well if you don't eat properly. I mean, I think a second thing that I really find is important, especially for runners in the Tampa area, is to have respect for the heat and the humidity.
Yes.
And this is something that I learned from Maria. If you look at the dew point, that's more important than humidity.
Thank you,
and I love Maria's has a dew point calendar calculator on her website, and I point my runners to that sometimes. People don't give themselves enough credit that heat is going to impact your performance. I lived in the Northeast my whole life. I moved here in 2010, and I was still pretty fit. I could run maybe a 21 or a 22-minute 5K then. I was walking on easy runs when I first moved here because that heat has such an impact. So that's and the third thing that goes along with it is hydration. You know, even if you're
Especially
not
in
sweating a
Florida.
lot, I think those three things are underrated things that runners don't look at that are important.
And I think-
Brian's my new favorite,
I was
by
just
the
about
way.
to say, Maria is like, I can see the aura just.
Actually, Brian's always been my favorite. Who am I kidding?
Because, I mean, if there's anything that Maria hypes on, it's calories. Make
Yep.
sure you got enough of
Yeah.
them. And
Yeah.
please listen to the dew point, watch the dew point, pay
Absolutely.
attention to it because
yeah.
you get from your runners, I'm a bad runner after months of being wonderful runners
Right.
in the winter. One day of dew point being high. And
But I love the way you put respect the humidity because I actually just saw Matt Fitzgerald was talking about that with altitude because he's starting these running camps, which look really awesome, by the way. But he said, as long as you respect altitude, then it will help you, which means they have to adjust for altitude. The elites are they're adjusting. So we need to adjust for humidity. It's the same thing. I mean, essentially, it's similar. Yeah.
Poor man's altitude.
Poor man's altitude. That's what we have in Florida.
So for all the Olympic, marathon runners, they go up to really high altitudes to train so that their body uses oxygen more efficiently. We can't go live in the mountains for 6 months out of the year, but we have poor man's altitude,
Well, and I
which
have
is
a runner.
living here.
Yeah, I have a runner in Colorado that I train, and I have to train her differently. She has to adjust. I mean, she's a completely different runner than when she's in Florida. So, yeah. Shout out to Kristen. She works hard.
Yes. And one more question. If someone says, what does tendonitis feel like? Because a lot of times we do get these little pains and go, well, is this something? Should I, what does a tendonitis feel like?
It's annoying.
I mean, it can range from just feeling it feels crunchy. You know, you feel like when you're moving, it's not a smooth movement. If you have swelling, that's a bad thing. So with swelling, we got to mitigate that, and it needs to be treated. You might need to take a few days off to address it. And I always tell my runners, it's like that old Amico, pay me now or pay me later with an oil filter. Treat that injury with respect as well when you first get it. Don't say, I'm just going to run through it and ignore it and then it'll get better.
Idea.
It's not going to happen, especially if there's swelling. But generally a tendonitis, like we talked about last week, it's going to feel worse in the beginning and then get warmed up.
Yeah.
That's usually what you're going to feel with a tendonitis. So if your pain gets worse as the run goes on, it might be that the tendon has a tear in it, or it could be a bone injury. It could be a stress fracture.
Yeah.
So, but if it gets, I'm just speaking as someone who is less likely to ask about problems. So if I start feeling bad and then as I run, I feel better, I might never ask about that. So where is that sort of where, okay, even though I feel better after these 3 miles, I need to remember to call the doctor because of what happened in mile 1.
That's what I say. If that's your yellow light. He taught me that. The green light, yellow light,
Right.
red light. I got that from
Right.
him. If it's starting to feel better when you're warmed up and stuff, that's when you call the doctor.
Yeah.
That's not when you ignore it.
And it's very common with plantar fasciitis, where when it first starts, you wake up, you take a couple steps, it hurts, and then it goes away. And a lot of times people are going to say, I don't think about it.
That's when you call Brian.
That's when you want to come in, because in that first 2-week period, especially with plantar fasciitis, a cortisone shot can completely knock it out completely.
Yeah. But
so
once it gets too
once you
inflamed.
pass 2-3 weeks, then it's going to be harder to get rid of.
Yeah.
Well, Brian, thank you so much. This has been wonderful. I feel like I now am a little smarter, as I always am when I finish these podcasts, whether it's with Maria or a guest, but certainly learning about injuries and the fact that we want to kind of go back to the beginning. These are short-term pains and injuries, not this killed my knees, I can no longer run. So that's kind of, we want to kind of wrap this up in knowing that running is not causing long-term issues. You just have to learn how to do it correctly so that it stays fun.
Exactly.
And Brian's business is Elite Sports Podiatry. Please, if you're a runner, go see a doctor that's a runner or an athlete, because it is different. It is different, and we are such a small population. We need all the help we can get. So go see Brian or go coach with Brian or whatever you want to do with Brian. You're gonna win.
Because you coached with him.
I
mean,
did.
He coached you.
He coached me. I think he coached me for about 2 years.
Yep.
We had a good time.
And now you are coaching with Run Tampa, but you're also just out there running yourself. And
Absolutely.
You're still,
Absolutely.
And you've had issues along the way as well.
I definitely have, and that's probably what when I tell my patients, I've probably had every running injury possible. So I know what they're we speak the same language. I think that's an important thing, and I've been to doctors myself. I went to an orthopedic surgeon when I first moved here, and the first thing he said to me is, "Don't you know running's bad for you?" And I was like, "Well, I'm not going to refer someone to you."
Yeah. Also, Brian is super humble, but he was a very fast runner. So you can tell us all what your 5K time was.
14:25.
What? Oh.
Yeah. It was amazing.
Long time ago.
Yeah. Well, yes.
And he knows so much about so many things running. It's so fun. Every time I go to his office, I'm like, I actually kind of am sad I haven't been hurt in a while because I can't go see him.
Well, this is why we get to share your knowledge with the masses, and we certainly appreciate you coming in and giving your time. And we will see you guys next Tuesday right back here. Run for Fun. So you appreciate running for fun, right?
Absolutely, absolutely. No, that was my college coach. His college they had Run for Fun on the back of their shirt, and I said, "Well, what's fun about running?" Well, winning.
Well, that's true.
Right? So.
That's also fun about running,
exactly.
too.
We want to run for fun for our whole lives. And
I don't know what
winning.
that feels like to win like you do, Brian, but
I'll be about 14 minutes behind you.
That definition's different for everybody.
All right, we'll see you. Thank you guys so much.
Thank you,
Bye.
Brian.
Thank you.